Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Ondo government gives workers till November 1st to get vaccinated. Zamfara government says measures are in place to ensure December 1st vaccination deadline for workers as it places civil servants first in receiving the COVID-19 vaccine across the state. And fully vaccinated international travellers arriving in cities of Sydney and Melbourne will no longer need to quarantine. And the WHO said Thursday that out of the planet's 135 million health staff, 80,000 to 180,000 healthcare workers may have been killed by COVID-19 between January 2020 to May 2021, insisting they must be prioritized for vaccination. The World Health Organization said the fact that millions of health workers remain unvaccinated is an indictment on the countries and companies controlling the global supply of doses. WHO Chief Tedros Ghebreyesus said healthcare workers needed to be among the first immunized against the disease as he slammed the global inequity in the vaccine rollout. The breakdown further shows that data from 119 countries suggests that on average 2 in 5 healthcare workers globally are fully vaccinated. But of course that average masks huge differences because in Africa less than 1 in 10 health workers have been fully vaccinated, while in most high-income countries more than 80% of health workers are fully vaccinated. Meanwhile, 247 new confirmed cases and 10 deaths were recorded in Nigeria. Let's take a look at the virus update.
247 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT, indicating an increase from the figures reported earlier. Plateau logged the highest infection with 49 cases, followed by the FCT, which had 46, Kano registered 29 cases, Lagos had 27, Kaduna 26, Gombe 14, while Bauchi, Cross River and Kwara registered 11 cases each. Other states, including Rivers, Ondo, Niger, Oyo, Edo and Ekiti, recorded a single-digit infection. There were no cases reported from Imo and Sokoto states. The new tally has increased the total confirmed cases in Nigeria to 209,960. 302 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 198,026. Lagos accounts for the state with the highest number of cases currently on admission, followed by the FCT, Delta, Benue, Akwa Ibom and Plateau states. There were 10 additional deaths from COVID-19 complications in the last 24 hours, raising the fatality toll to 2,850. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. More than 5.4 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 2.8 million persons have been fully vaccinated. In Africa, there are more than 8.4 million confirmed cases and over 216,000 deaths have been recorded across countries on the continent. But total global confirmed cases have surpassed 242 million, while deaths are beyond 4.9 million.
Ondo State has joined a few other states in Nigeria with the directive that all government workers in the state to be vaccinated against COVID-19 before the 1st of November 2021. The directive, which is from the head of civil service of the state, Adeniro Adeyemo, is aimed at ensuring that workers are well protected against the deadly virus. While states like Edo have started implementing this directive, the Kaduna state government has given October 31 as the deadline, while the federal government's ultimatum to federal workers is to vaccinate before December 1.
We encourage civil servants You know, we deal with the public. We don't want to embarrass the public. We don't want them to be contaminated. So that's why we are encouraging civil servants to ensure they take the vaccination in addition to other COVID-19 protocols. Washing of hands, covering of nose and mouth, and sanitizing, and of course, that people should not hug or shake themselves or not. So because we are serving the public, and we don't want a situation where, while serving the public, we will inflict injury on them, especially this COVID-19 pandemic. That's why government is encouraging all civil servants to ensure they are vaccinated. The permanent secretary in charge of the agency, Primary Health Care Development Board, assures that there are enough vaccines. It's not a total directive, it's an encouragement. That I want to encourage to make sure they take the vaccine. You know, it's always double dose. After the first one, it takes a period of time before the other one. So there is no way we will prevent them from coming to their offices to do it, but we want to encourage as many as possible.
The Executive Secretary, Zamfara State Primary Healthcare Board, Dr. Ismail Tukur, has assured that the state will meet the December 1st deadline given by the federal government to vaccinate all civil servants to contain the spread of COVID-19. Speaking in Gusau, the State Primary Healthcare Board explains that the state adopted a viable strategy to vaccinate the civil servants.
The announcement by the federal government to make COVID-19 vaccination mandatory for civil servants from 1st December 2021 may have caught some Nigerians by surprise. However, civil servants in some states are not opposed to this directive. In Zamfara State, the Executive Secretary of the Primary Health Care Board says the government is working to meet this deadline by expanding the facilities to include private health facilities to aid access to the vaccines.
The strategy we adopted now, as we align with the National Primary Health Care Development Agency, was to routineize the COVID-19 vaccination, rather than implementing it as a campaign in the past, where we'll invite people at a particular site or level. We are now routinizing it. We are making it a routine activity. We are giving the COVID-19 vaccination the same strategy that we are giving all other vaccine preventable antigens in the community. So, and we also expand the number of facilities that provide these services, including private facilities, high volume facilities, private facilities, and even corporate organizations are given special consideration. So we are really expanding, we are giving it a broad base where everybody will have access to the vaccination on a daily basis.
One of the healthcare workers in the state is advising all civil servants to dismiss myths regarding the COVID-19 vaccine and make themselves available for the jabs.
People should actually turn up. It has a good effect on people's body. So all these superstitions are just lie. None of them is actually true. So just come and protect yourself, get vaccinated, so that at least you can be able to withstand this COVID-19 when you come in contact with anyone that has it.
While the Zamfara state government is advising residents to adhere to all non-pharmaceutical measures, they are also engaging traditional and religious leaders to mobilize their communities to ensure the proper management and control of the COVID-19 virus.
According to health experts, viruses constantly change through mutation, and new variants of a virus are expected to occur. Sometimes new variants emerge and disappear, other times new variants persist. All variants of the virus that causes COVID-19 are being tracked in Nigeria and globally during this pandemic. And joining us to talk about this is Dr. Bamidele Iwaluku. He's the Director, Central Research Laboratory, Nigeria Institute of Medical Research, NIMA. He joins us here in Lagos. Thank you for joining us on the program.
Thank you for having me.
Right, tell us first about the variants that are currently circulating in Nigeria.
Currently, we have 55 lineages of COVID, SARS-CoV-2 variants in Nigeria. It's very important for us to understand the difference between variants and the lineages. So the variants, like as you said, emerge every time the virus replicates. So that is a natural event. We also have events that is mediated by the host, which we call the gene editing event, which we cannot actually determine how the extent to which it will happen, but we can say that when it happens, it gives more mutational changes on the genome of the virus. So we have these variants, and by classification, they are divided into 4 groups. We have the variants of interest, which we call the VOI. We have the variants of concerns, and the variants of high consequences, and the variants being monitored. That is the latest classification. The variant being monitored is actually to be based on knowing the variants in circulation in a particular country. So the VOIs, the VOCs of WHO classifications can fall under VBM for a country. Now, for ease of understanding these variants, there are Greek alphabets that have been assigned to them. We have the alpha, which started the second wave in Nigeria too, which is the UK strain that has also expanded. So we have the Q lineage expanding the descendants of the UK variant. You have the South African variant, we have, which is the beta. We have the descendants of that as well. We have the gamma, the Brazilian type, the P.1. We also have descendants. Then we have the delta. So the delta now has also divided further into lineages. So we have the AY lineages, which is also the delta plus. So the difference has to be with unique mutations that they elicit at different locations on the genome of the virus.
But which one is more dangerous for us?
The VOCs, the UK, the Delta, the Beta, they are more dangerous. But in Nigeria, we don't have Beta. The second and the third wave was as a result of the introduction of the Delta. But at this point, at NIMA, in addition to Delta variants, we are also identifying other variants that are co-circulating. The UK variant is still co-circulating with the Delta. We've had one case of the California variant, which is the IOTA, which is B.1.427 and 429. But we also have the typical Nigerian variant. We call it a Nigerian variant, which is the ETA. It's B.1.525 because it accounts for 14% of ETA variants all over the world. And it co-emerged in UK and Nigeria and has persisted, causing COVID-19 in the country.
It's as dangerous as the Delta.
It's not as dangerous as the Delta. The Delta is more dangerous in terms of the extent to which it can spread, because the reproduction number of the Delta is between 6 and 8. And the consequence of Delta is that it pushes our herd immunity, the percentage of Nigerians that will be needed to be vaccinated to have that. So
Okay,
Yeah.
I want to quickly ask the final question, and this is, I mean, do you think that the first generation of vaccines is able to tackle these variants that are circulating?
So we are still looking at the data, but what we know is that some countries are already implementing the policy of a booster dose for either Moderna or AstraZeneca vaccine. And the extent is to further reduce, to improve efficacy of that vaccine in protecting against clinical manifestation of COVID-19.
So as to do same?
Yes, it's advisable if we have enough vaccines. Currently, we need to increase the number of vaccines in country and increase the coverage.
We appreciate your time. Thank you so much. We'd like to have you join us again to talk more about this issue, the pandemic. Dr. Bamidele Waluko is the Director, Central Research Laboratory with NIMA. Thank you so much for joining us.
Thank you very much. Thank you.
Germany's infectious disease organization, the Robert Koch Institute, has warned that the country should expect to see another spike in COVID-19 cases for the rest of the fall and winter after months of declining numbers. The institute said that there were worrying increases in coronavirus cases in nursing homes, even among the vaccinated, as those who are elderly and have pre-existing conditions are still at greater risk to the disease. They issued a recommendation that large unmasked gatherings continue to be avoided at all costs, particularly indoors. And it's not just Germany. Russia, for example, is enforcing a one-week work shutdown nationwide, while Romanian funeral homes are struggling to keep a surge in fatalities. Deutsche Welle correspondent Janelle Dumalaon joins us now from Berlin with more. Hi, Janelle. What is the situation with the rising cases in certain places in Europe?
Well, it really depends on where one is. Here in Germany, for example, towards the middle of the week, we saw 17,000 cases being added within a 24-hour period, and that's prompted the Disease Control Authority in the country to warn that travelers returning from holiday breaks this autumn may be contributing to the spread. But it's worth noting that other countries in Europe are experiencing a worse surge, especially if you look towards Eastern Europe and the Baltics. We're talking about countries like Russia, Romania, Latvia, and Bulgaria. And it's thought to be uneven vaccine distribution and a low vaccine uptake that's the main driver of the spread. In Romania, in particular, the government has complained of vaccine disinformation hampering inoculation efforts. And now we're in a situation in Romania where it's thought that every 5 minutes a person has died of COVID this October. Now, the World Health Organization has said that uneven vaccine distribution is the biggest enemy in Europe when it comes to fighting the COVID-19 pandemic, and they're being proven correct in all sorts of bleak ways.
But Janelle, how have the affected countries really reacted to the spread of the virus?
Here and there in pockets of Europe, there have been a tightening of restrictions. Latvia has become the first country in Europe to return to lockdown amidst this fresh surge of coronavirus cases. Russia has mandated a one-week work shutdown, has also told retirees over 60 years old to stay at home for 4 months. And in Romania, there have been tightened restrictions as well. They have said that only vaccinated people can travel at night and that masks have to be worn even on the street. Now, those are just some examples. But what will really make the most difference here is, of course, a ramping up of the vaccination drive. Failing that, it will be very difficult to turn the tide anytime soon.
And EU leaders are meeting in Brussels for the European Council summit. Anything about the rise in coronavirus cases on the agenda?
So far, the rise in coronavirus cases has taken a backseat at the summit as other concerns dominated. We're talking about migration, about the rise of energy prices across Europe, as well as Poland's ongoing battle with the EU over the primacy of EU laws over national laws in member states. But in the invitation letter sent out to EU leaders ahead of the summit, the need to tackle these rising cases, the need to combat vaccine disinformation, and the need to distribute vaccines to poorer countries, those things were explicitly mentioned. As such, it is certainly expected. We're now at day 2 of the EU summit, and observers will be watching closely to see what leaders have to say about these developments.
Bush fellow correspondent Janelle Dumalao, thanks and enjoy your weekend. And to other stories, British Prime Minister Boris Johnson says there is nothing to indicate that the country needs another COVID-19 lockdown. He adds that rising levels of the infections were predicted in government models and they did not herald a return of stringent lockdown measures. He's now encouraging people to get their booster shots, taking into account the warning effectiveness of the first 2 jabs.
I think that people should be coming forward with the same spirit of determination to get their boosters as we saw earlier on this year. It's a very good thing to do. It gets you a huge amount of protection, and we always expected that we would see numbers rise right about now. That is happening, and you've also got to take into account the waning effectiveness of the first 2 jabs. So get your boosters now.
And daily deaths in Russia hits a record high for a 4th straight day. Russia reported this record today, with still a week to go before the start of a nationwide workplace shutdown ordered by President Vladimir Putin to try to curb the rise in infections. Meanwhile, Australia's Melbourne exits its 6th lockdown. Here's more on the Global Update.
Russia has reported yet more daily cases of COVID-19 infections and deaths, with 37,141 new cases and 1,064 people dying in the past 24 hours. It's the 2nd successive daily case record and the 4th straight day of record deaths this week, a surge that has prompted authorities to reintroduce restrictions and renew calls for people to get vaccinated. The Australian state of Victoria has announced that hotel quarantine will be scrapped for international travellers from November as state capital Melbourne emerges from the world's longest lockdown.
90.5% of Victorians have now had a first dose, and 71.1% of Victorians aged over 16 are fully protected by one of the COVID-19 vaccines. That's why today we can end the lockdown. That's why today we can begin really meaningful steps to open up our city and state, to have our freedoms back.
From November the 1st, fully vaccinated international travellers arriving in the cities of Sydney and Melbourne will no longer need to quarantine. Under more relaxed rules, restaurants and cafes can reopen with up to 20 people indoors and 50 outdoors, all of whom must be vaccinated, while 10 guests can gather at homes. Masks will remain mandatory. In neighboring New Zealand, Prime Minister Jacinda Ardern says the country will end its strict coronavirus lockdown measures and restore more freedoms only when 90% of its eligible population is fully vaccinated.
The more people who are vaccinated, the harder it is for COVID to spread through communities quickly and find our most vulnerable. That means while we used to say that we needed to stay home to save lives, we now need to be vaccinated to save lives.
Over in Iran, mass Friday prayers have resumed in Tehran after a 20-month hiatus due to COVID-19 pandemic. The resumption comes as authorities warn of a 6th wave of the coronavirus, which has so far claimed 124,928 lives in Iran and afflicted more than 5.8 million. Worshippers had to heed social distancing and use face masks during the gathering.
Fresh air can help reduce the spread of COVID-19. If you're meeting friends, head outside to help drive the virus away. Continue to take responsibility. You can visit our website. It's channeltv.com. You can find our breaking news stories and a better understanding of the pandemic. And that's COVID-19 update program at this time. Thank you for watching. I'm Millicent Walker. Stay healthy.